Welcome to the Habits and Hustle podcast, a podcast that uncovers the rituals, unspoken habits, and mindsets of extraordinary people. A podcast powered by Habit Nest. Now here's your host, Jennifer Cohen.
So welcome to another edition of Habits and Hustle. And today we have a very special guest who is here from South Carolina. His name is, I always pronounce this wrong and I know I'm going to do it again, but Dr. Koniver.
You got it.
Oh, I got it.
You got
it. Good. Okay. I usually say carnivore, so yeah. Koniver.
Yeah. Koniver's it.
And he's a performance medicine doctor. I've never heard anybody actually refer to themselves as that. So can you give us what and who you are?
Sure. Well, thanks for having me. I appreciate being here. Yeah. So performance medicine, I think I came up with the term. I'm family medicine trained, but kind of operating outside of that jurisdiction pretty much for my whole career, so to speak. And I got involved with the functional alternative medicine crowd, and that never really felt right. Just because a lot of functional medicine is based on this kind of robotic principle that we're all the same. And in many respects, functional medicine has the same mindset as, allopathic medicine, which uses a pharmaceutical model. And functional medicine uses the nutraceutical model. We're just going to take this for that.
Well, I was going to say to you, actually, when after you told me, or once you kind of gave us the definition of what a performance medical doctor is, I wanted you to kind of give us the difference between what a functional medicine doctor is and what a performance optimization doctor is, right?
So functional medicine, a lot of people more of chronic disease, they've got problems, whether it's diabetes or autoimmune disease, cancer, and they're going to see a functional medicine doctor because they want to get to the root cause, maybe. So they're going to have a lot of different lab tests performed on them, and in general, then they're given a litany of oral supplements to take. Most people, if you talk to, and I have had the privilege over the years of doing this, is, I'll give you an example. I had a guy just start doing treatments with us 2 weeks ago, and when I met him, he literally had a backpack full of 50 supplements. Yeah, and he emailed me a list of his regimen, which was 5 pages long. And when he came in, I said, I'm not sure we're going to be a good fit because you being this vigilant and doing all this is part of your problem. Right? That is very stressful to have to organize your life.
Absolutely.
Around every couple minutes taking something, which you don't, and he couldn't even tell you what it was for.
Oh, yeah.
And so that's kind of how I see functional medicine, and I think it has its place. But I think most people want to not only feel well, but they want to perform their best as they get older. Absolutely.
Well, it's interesting because I've been to a bunch of functional medicine doctors, and you're right. And what happens is you do get a plethora of different supplements to be taking and lab tests to be doing. But over time, you just end up, if you're busy also, you just end up not doing it because it's too difficult to kind of keep on taking 47 different supplements and also not understanding why and what. You lose track of all of that. And quite frankly, it doesn't always make a difference.
Most of the time, it doesn't make a difference, and part of that is the mindset of, again, taking this for that. Like you, all of us have things that we want to improve upon. There's always going to be a supplement that you could add in. So if that's how you approach it, where now I want to run faster, I want to sleep better, you're just stacking different supplements.
Yeah.
You're not really getting to actually helping the patient really make difference in their life.
So as a performance medicine doctor, do you not believe in taking supplements and medication?
I do.
Okay.
Yeah, no, I think everyone should have all the options on the table.
Okay.
So we just think of ourselves as having a really gigantic tool bag.
Got it.
Lots of tools. But we believe, because just from experience, because I got involved with doing these nutritional IVs very early on, 16 years ago, well before the hangover IVs were, trendy and in vogue. And so just watching and observing how fast these therapies can work, and then getting involved with other injectable therapies, now it's a lot of peptides, that moves the needle really fast for most people. And kind of a basic tenet I have with patients is I just want them to get to feeling better first. I don't care what the diagnosis is, which is very different than the conventional mindset of we have to have the diagnosis, then we work the diagnosis by giving medicine and running labs to support continually giving the patient the medicine to support the diagnosis.
Right, yeah, I got you.
It's this very convoluted way where you don't really get anywhere.
Right, it's like a vicious cycle of a hamster wheel of stuff. Well then so you said peptides, and obviously I want to get I really want to dig into that because there's a lot of most people don't really understand what they are, or there's confusion, or there's just not really that much known. to the, layman's person who's not in the industry.
Sure.
But when you see a patient, then who is your typical patient? Because you are an MD doctor.
I am.
Yeah. So tell us how you kind of even evolved from being, because you're a family, you were trained as a
family medicine. You're right. So after my residency, I wanted to open my own practice because I wanted to do things differently. Got involved with these nutritional IVs.
Right.
And at the time, it was like a traditional primary care practice, took insurance, but then on the side, we did a lot of these IVs. And then I saw, well, these are really working. How do we make this work better? And I actually then developed our own IV called a fast vitamin IV, which we use a lot, which is a 30 cc volume of B vitamins, magnesium, and amino acids that we push.
Oh, you used to push. That's what I said.
So we developed that. That's our thing. We do a ton of that in the office, and then we actually work with close to 100 different physician groups across the country that also purchase that from us.
Is it a patent? Do you have a patent on that?
We don't have a patent, but we have a trademark on the name, and it's our thing, and it's works really well. And so from observing how quickly you get someone from feeling, down here to up here, even just using that therapy, just after a couple of weeks, people were feeling so much better just from giving them nutrients in a proactive manner. That was a big shift because 14, 15 years ago, the only people doing IVs were people who were sick, chronically fatigued, looking for some health issue. And I thought, these work so well, why don't we use them proactively just like a supplement?
Right.
And so the idea, it becomes about bioavailability. And one of the biggest problems with oral supplements is for most people, you just don't get that much out of it.
Right.
So we estimate if you take any sort of oral nutrient, whether it's food or supplement, you only get like 20% return. Yeah. Whereas you're using an IV, it's closer to 100%. It's a big difference.
So the argument that I've heard over these IVs, because I am very familiar with IVs. I think by now people have heard about them. Now just to play devil's advocate, people would say that, it doesn't, like you were just mentioning, you were saying earlier, that doesn't all get absorbed, because a lot of people say, it's a waste of time and money, because when you have these big bags of fluid, you're going to pee out most of it. So is that, when you're talking about the thing that you do, which is called, what is it called again?
Fast vitamin IV.
Yeah, fast vitamin. Do you kind of eliminate the...
Yeah, we flip the script. So most people are using these slow drip IVs where they put in a lot of fluid. You dilute the nutrients to very small. Right. It drips in, takes an hour to 2 hours, and people don't feel it. They don't notice it. Ours literally takes less than a minute. So the advantage there not only is it's quick, right? So when you get it, but then because it's fast, you can do it regularly, right? And so when you're doing it regularly, and that's what happened with us, with our patients are doing it every single week. We work with professional athletes, high octane type people. They're doing it multiple times a week, right? Because it's so easy. It's literally a minute of your time.
And can you do it yourself?
No. You
can't, right?
No.
Because it's still a needle.
It's still IV. We're still putting a needle in the vein, and then we're just pushing it. And we've tested it. I mean, we've never, ever, ever had an adverse reaction. Right? Really? Yeah. Because so it's super safe.
Okay, so that's what's really... Okay, so basically, I was going to say, because a lot of these times it takes a long time, which then people don't want to do, like me. Yep. So then I think I'm peeing it out anyway. What's the purpose? So then I just kind of go back to my regular supplements or whatever that I would take. So with this, it just takes like a minute, basically.
Literally a minute.
Wow. But okay, so what do people do if they don't have access to you, or they have
well, that's what we hope to change.
Oh, okay.
So like we work with people, and if they want to have a nurse or they're under another doctor's supervision, then they can work with us in that same capacity. So whether you're in Minnesota or California or
so you can so people can actually use this type of...
They can. I mean, there's certain requirements outside of our office, and then we have a whole nursing network across the country that we utilize for the same purpose.
So what are these fast IVs? What can they help with? Give me some examples.
So what it's composed of is the things that most people are deficient of, because we do a lot of nutrient testing over the years. Right. There's 3 big things that most people on average are deficient in. One are B vitamins, magnesium, an important mineral, and then amino acids. Right. So that's low-hanging fruit in my opinion. Right. So that's what a fast vitamin IV is. Low-hanging fruit is just we're restocking those things people need most. And so it usually takes a couple weeks, but most of the time that light turns on after a couple weeks if you do it consistently. Colors look brighter, you have more energy, you sleep better, your mood's better. Because if my lens of the world is very biochemical. Like that's how I see things. If we get things optimized, balanced, then literally that's how we're making change within our system to help people feel better.
So this is how basically, so you started as like a regular family physician, and you kind of then started doing a little bit of this stuff on this on like the side?
Not really on the side. I mean, it was just at
the
the same time, and then watching that grow and then having success.
And it being effective.
Super effective. And so then I stopped taking insurance because I wanted to go a different route. Because to me, family medicine, why I chose that was building relationships with people.
Right.
And in the primary care insurance-based model, I could spend 5 to 7 minutes with the patient. I can't be valuable. I'm not feeling like I'm contributing. They certainly can't feel like I'm contributing, because how do you do that in 5 minutes? So I scrapped that model, went to a direct pay model, like a concierge, where people pay, but they value that time, so you get to know people. And then when you're invested in that with each other, then you actually can really make change, right? Because it's more of like a proactive gym model. People are going to pay to work on themselves, which is a totally different mindset than the conventional medicine model, which is I'm going to just use my copay to come see you for some ailment that I have.
Absolutely. Well, okay, I have a bunch of questions here for you because, and I love that we were saying this before we started this podcast, that it's kind of what I say in my Jewish world, beshert, that I actually called you. Are you Jewish?
I am.
Okay, well, because people have told me about you here, and I didn't realize that you have so many clients all over LA and everywhere else around the world, and you're like the go-to person for a lot of these longevity or biohacker type of people. So I figured, I wanted to get my information from a great source. And that's how we kind of and just by coincidence, you're going to be in LA 5 days or 6 days later. So I figured I want to take this opportunity and ask you a bunch of questions.
Awesome.
Okay, so let's go right into peptides, because you already touched upon it a little bit, and it's in my space, in the wellness health space. People are already dabbling in it, but on a more macro level, people don't even know what it is, right? Can we talk about what a peptide is? What is it used for? And just kind of go from there.
Yeah. So peptides in the very simplest form are chains of amino acids. Amino acids people are familiar with. If you work out and you take these, workout powders, protein powders have a lot of amino acids. They're kind of the building blocks of life.
Right.
They contribute to building solid structures, tendons, ligaments, bones, neurotransmitters in the brain, the nervous system. And so what a peptide is just these different amino acids that are put together in novel combinations. So on the technical side, it's called a peptide if it's less than 40 amino acids together, and then it's called a protein if it's greater than 40 amino acids. So these are all naturally occurring things. They're synthesized in the lab, and then they're used, the vast majority of them are injected subcutaneously to exert their effect. And they grew up in the CrossFit world, actually. This is where we see them several years ago, where CrossFitters, particularly competitive CrossFitters, were looking for an edge. And peptides have become like the modern day anabolic steroids.
Right. But
they're different in large part because they're so safe. Like, we rarely see any negative side effects. I mean, it happens, but it's super rare.
So how does it have the same effect of a steroid, but yet be completely safe?
I mean, it's not having the same effect. So anabolic steroids are hormonally based, right? Like, they're testosterone analogs. So they're like testosterone, but in many ways stronger, right? And so testosterone is a foundational hormone for men and women, but testosterone even has its problems. That you can get estrogen build up, you can build up your hemoglobin, you can get fluid retention, can affect your liver. What we think works so well with peptides is because they're small molecules, super small. And because they're so small, they can bind receptors on cells, and that's it. So it's very specific. So in the case of the CrossFitters, what the first kind of grouping of peptides that become popular, which most people will touch them first, is the growth hormone releasing peptides.
Okay.
These are group things named like ipamorelin, GHRP6, GHRP2. The first one was semirelin.
Right.
It's kind of weak. We don't use it, but we used to.
Why? How come? What happened to it?
It just doesn't work as well. So it's just like a first generation.
Okay.
Now we're at like third and fourth generation different peptides.
So then what's the newest generation of the human growth hormone?
Well, tesomerilin's one that's probably getting utilized more because of its fat burning properties, and so many people want to be more lean, burn fat.
Right.
And that's a kind of a unique one we can talk about. But what that does, so we used to use a lot of growth hormone with patients, and growth hormone is a very anabolic hormone, meaning healing, rejuvenating, mending to tissue. And if you're a professional athlete, like you're a pitcher and you injure your elbow, you want to be back in 2 weeks, not 2 months.
Right.
Well, growth hormone is amazing for you in that regard because you'll get back really quickly, you'll heal your tissue. Problem with growth hormone, several problems. One, very cost prohibitive, very expensive. Two, when people use growth hormone, they tend to think if a little is good, a lot is better, and that's not the case. And so people can get some, manipulate that hormonal dynamics. And you can, with growth hormone, you then start suppressing your own growth hormone output. Peptides, the growth hormone releasing peptides, when you take one of those, you're just telling your pituitary, which releases growth hormone, to put out more growth hormone. So you can only put out what you can make. So you can never manipulate that access, which is awesome. Yeah, so very safe. And then not only can you then help direct the output of growth hormone, you can help direct the timing of growth hormonal output. And again, because we do a lot of testing of patients, as people get older, it's one of those hormones that declines. We call it the anti-aging hormone because it affects so many things relating to being durable, your skin, your sleep, kind of how you think physically, how well you recover from exercise.
So is that why most people, when they start the peptides, number one, they start with the HGH, the one that you said, the CJC or the ipamorelin,
the ipamorelin. Yep.
Okay, so isn't that like so it's like kind of like the safe and legal version, because the other ones are illegal, aren't they? Technically illegal.
Anabolic steroids.
Well, yeah, but I'm saying with athletes, if an athlete would take a peptide, would they be considered
a professional athlete?
A professional athlete.
Yeah, most of the peptides are banned. They're on the WADA ban list, on USADA, World Anti-Doping Agency, United States Anti-Doping Agency.
Peptides are.
Most peptides are banned.
But why? If it's a natural, if it's an amino acid and it's a natural producing substance.
Because those organizations politically want to, hinder what their, their premise is. We want to keep the playing field level, which is a false premise, because we can go down that pathway. But there's so many things that are performance enhancing, which are not chemicals, right?
Yeah.
You having a private chef is a performance enhancer. Certain pillows, mattresses you sleep on, red lights, cryotherapy, these are all performance enhancers. Some people will do them more.
Yeah.
Well, what's wrong with that? Nothing.
But it's not an injectable.
But even an injectable thing, which may help you recover more so that you can be a better athlete and is safer, I don't understand why that's bad. And why is it bad if it's going to make you a better performer?
Yeah. Well, what I find completely hilarious, not hilarious in a funny way, I guess that's the wrong word, ironic, in Lance Armstrong, for example, there were so many people were taking things. It's like
they still do.
And they still do, secretively, right?
They still do.
And they still do. I mean, so isn't that like, and then he gets caught for what he does, whatever. But
he never got caught. He was whistleblown. He never had a positive test. And so never.
Oh, he never had a positive test?
To this date, he's never had a positive test.
Oh, I thought, oh my gosh. So he was whistleblown. So then technically he could have said, it's not true. Is that what you're saying?
Well, that's what
he maintained. Did you watch this documentary, by the way?
I did.
Yeah. I was in it. Did you see me in it?
Maybe. I don't remember.
No. Okay.
We watched it, yeah.
Yeah.
I know that story very well. And so.
I'm sure you do.
Yeah. And so he never had a positive drug test.
Oh, I didn't realize that.
And if you go back to Lance Armstrong specifically, all the racers at the time were doing what he did.
That's what I'm saying. So it was a level playing field in a way.
100%.
Yeah.
It still is. No one was going to be Lance Armstrong. Like he won the Tour de France 7 times in a row after having metastatic testicular cancer, went to his brain, had multiple brain surgeries. Like that's a very special human. And to try to take that away and say you did it because you did doping with HGH, testosterone, and things to your blood, that's totally inaccurate.
Yeah, I agree with you. It's like a very touchy subject with some people, because I think sometimes I think it's like, it's like schadenfreude. People like, do you know what that is? When you kind of get pleasure in other people's like misery kind of thing. I think
it's jealousy. Tons of jealousy.
It is jealousy because it is a level playing field if everybody's doing it.
They are.
And he still can be, I mean, this is a whole long conversation, but.
Well, I think they should open it up and allow it.
Right.
Because why not give everyone, again, equal access, and let's see how people do.
Yeah.
Right? Because if you look at sports, like in 1998, the most excited people were about Major League Baseball was when Mark McGwire, Sammy Sosa were doing stuff.
Yeah.
It was like the reemergence of baseball. It makes a better sport, which sports is entertaining, but also protects the player. And most of it's about recovery. And these guys, particularly Tour de France athletes, Major League Baseball players, they put their bodies through the rigors. Giving them tools to help them recover, how is that bad?
Well, I mean, you're the doctor, right? And you tell me.
Well, I think people can overdo it.
I think that's the problem. I think there's a big there's a lot of like stigma around it, right? Because what happens is people can and do overdo it. And
but at the same time, I mean, it brings up a larger point. We work with a lot of former NFL players, right?
Right.
Well, they've had multiple concussions to their head that's totally legal, that has changed their life. A lot of these guys with broken brains, which are in terrible shape, but that's allowed? Like, that's okay, but right? Like, it's so, I don't understand the argument. It's a political argument, and it doesn't add up anymore. I think hopefully it gets changed at some point, because one, we'll have better competition, we'll be able to protect the athletes better, and we'll actually be able to learn more.
Yeah.
Because learning about how elite athletes perform and what works for them helps the rest of us who can never get to that level.
Oh, absolutely. Yeah. So let's stay on this, how elite athletes perform and peptides for a minute. So are they FDA approved then?
No, they're not FDA approved. I think of them like injectable supplements.
Yeah.
So naturally occurring things, but you inject them.
Right.
So they're not FDA approved. I don't think they need to be FDA approved, because that would take too long. I mean, that's a good 10 to 20 year process usually.
Right.
And so these things have a very, very safe track record when used in animal studies and some small human studies. And then the biochemical studies, they work really, really well. So they've been tested. It's not for everybody, but I think people, when they understand and can learn and get informed information about what something is, then it's up to them to make the choice if they want to try it.
So what happens if, like, how about cancer, right? If you're able to like turn your cells around faster and recover faster, that's about like cellular generation, right? Regeneration. Could it be cancer causing then, or no?
Well, I mean, you're asking a really tough question. Like, you're asking what causes cancer, and I certainly don't know.
But you're the doctor.
I'm a doctor, but so I mean, I have theories that it's multiple things going wrong at the same time.
Okay.
And I do believe that all of us, have to deal with some cancer at some point. We're just, our immune systems are to a point where we can handle it.
Right.
Stage 1 cancer becomes stage 1 when you can see it radiographically. Stage 0 is cancer that we can't see. It's starting. And actually, we use peptides in different IV therapies, hopefully to prevent that from happening with people, to help give people the tools, biochemical tools, to boost their immune system, to get it back in check, so you can actually be stronger and never get cancer.
Really? Well, I think a lot of these things in terms of longevity, I asked this question too, right? Even like red light therapy, right? Which, is a big trend right now for inflammation and for like fine lines, for vanity reasons and for actual health and recovery reasons. And then that same question is if it's turning your cells around, again, is that cancer causing? And people can never answer the question.
Well, because again, here's part of the problem. To answer that question, you'd have to isolate so many variables in certain populations of people to ever get to that place, which is going to be impossible, right? Like, you'd have to give everyone the same diet, supplements, sleep the same hours, think the same thoughts, exercise the same way, control for genetics. That's impossible.
There's too many variables for each person.
Well, that's why people should know that any human study, you have to be very skeptical of, because we can never control for all the variables.
Yeah.
Ever. So we're making determinations on pharmaceuticals based on, okay, well, this seemed to work in this population, but that is not necessarily the whole picture.
Right.
Like, for example, I tell people with antidepressants, like, it is literally a coin toss whether an antidepressant should work for someone.
Oh, really?
Top 3 drugs prescribed, but literally a coin toss. Like, 50% of the time it won't work.
So what happens then? Do people stay on them?
No, people have side effects. People have a lot of side effects from being on antidepressants.
No, I'm saying, tell us how would they know? A lot of people just get put on these things for.
Well, and so if you look at what is the origin of having depressed mood, most of it has nothing to do with taking a deficiency of Prozac per se.
No, I know, but it's I'm not on this, but like a serotonin uptick.
So serotonin is one of the players, but so are so many hormones. So many, so many nutrients, right? So you could dial it back to, for example, what I tell people, since the 1990s, the rates of anxiety and depression in this country have tripled.
Yeah.
Well, that's
and now probably even could
after COVID, even probably, yeah. Well, the 1990s when we saw this low-fat dieting start. Remember, SnackWells?
Of course, SnackWells.
Right, yeah. So our brain is 70-80% fat.
Yeah.
The vast majority of people don't eat enough healthy fat. So all we got to do is make that change, but we won't, because medicine doesn't approve that. What you eat, they don't think that. The
nutrition portion of it.
I mean, you can, oncologists, I've seen it so many times, people diagnosed with cancer, okay, doctor, should I eat a certain diet? That has nothing to do with your health. Like, really?
Really?
Oh, that's common. Yeah, no. That's the mantra.
I feel it's changing a little bit, but I think that it's a little bit archaic in what the diets they put you on. A lot of times they say that they keep you with a low-fat diet. They think that eating
that's healthy.
4 pounds of like pasta, but no butter is still okay. I mean, or no olive oil or whatever it is. No, I agree with that.
But part of the problem even with that, with diets, and my philosophy is a little bit different, because I think what you think about the food is actually more important than the actual food.
What do you mean what you think about the food?
Like what you think the food will do for you. If you have a healthy view of that food, it's going to work better for you. Just like everything in life.
Like everything in life, yeah. Like your perspective.
Effect.
Yeah, the placebo or nocebo effect.
Yeah, so if you don't believe with peptides, if you're like, someone's giving someone peptides, no idea what it is, and doesn't believe in it, probably not going to get the same outcome benefits as someone.
Really?
That's anything in life.
Okay, so who should try peptides, and then why? I've got two parts to this. Why is it then, if there's so many peptides, and I've got a lot of friends on them, it's usually then the same peptide that everybody I know is taking?
Yeah. Well, so let's go back. So we have the growth hormone releasing peptides.
Okay.
That's where they grew up in the CrossFit community.
Yep.
There's 5 of them that we use. Ipamorelin, GHRP6, GHRP2, hexarelin, and tesamorelin. They all have a little bit different flavor. And depending on the goal is how we kind of help people decide where you want to start. You know, the kind of general one is the ipamorelin, because it's a clean one. It binds that growth hormone receptor better than all the rest. So it's very specific, but it's not very strong. So it's a really good starter peptide because most people have a little bit positive uptick in energy, may get a little bit leaner, sleep a little bit better.
May get a little bit leaner, not necessarily.
May not, right, because there's a lot of factors. I mean, people could be doing a peptide injection all day long and eating like crap.
Oh, yeah.
And so there's a lot of variables here. Again, going back to the variables. So so we usually start with ipamorelin if it's just like someone who wants to be, you know, stronger, fitter, faster, which is what most of us want anyway.
Sign me up.
Right. Yeah. And so then, but I like people to try lots of different ones, because how do we know? You don't know. And so a lot of people aren't open to the trial and error of like, I have some ideas about what I think will work, but the only way we know is if you try it. And then, you know, like hexarelin, for example, is a really good one for endurance and good for the cardiovascular system. So we use that in the morning for people who are endurance athletes.
Oh, okay.
Tesamorelin is really good, seemingly for, you know, visceral fat loss, which is the fat around the organs. So, and it works better in women than men.
But visceral fat, I mean, fat around the organs, don't you have to be you have to be somewhat overweight? You can just have some extra, like, you know, pounds on you, but not have any visceral fat.
No, everyone's got some.
No, but like, I mean, not visceral fat. Sorry.
Subcutaneous.
Yeah.
Well, but it's not going to just work on the visceral fat.
Okay.
But that's a helpful thing.
So why does that one work for women more than the other ones? Just
question.
Because?
I don't know the answer. It's just an observation.
So when someone comes in to see, like, what age bracket are going on this? You see young people on this?
Young people, you have people in their 20s who are, again, fitness probably, and then people in their 60s who are, you know, having to deal with more stress in their life, and they may be more into working out and want to lose some weight, or they may, who knows?
They'll go on. What's it called?
Ipamorelin?
Yeah.
Yeah, for sure.
60-year-olds?
70-year-olds, 80-year-olds, 90-year-olds.
Even 90-year-old patients taking peptides? Okay.
Yeah. Wow. Very, very safe. Again, across the board, most peptides are super, super safe. We don't see reactions.
But they have to inject themselves, right?
Or have someone do it to them.
Okay.
And we use a very small insulin needle, very easy. You can inject it once or 2 times, and people have no problem with it.
And no problem.
No problem.
So that's one of the main.
That's the big one. That's the big group, the growth hormone releasing peptides. Then we have these anti-inflammatory peptides like BPC 157.
Yeah.
BPC is body protection compound. It's anti-inflammatory, good for the gut lining, but also good for protecting the ligaments and tendons. And we have a lot of people, because we see a lot of athletes, various competition levels, who you can argue should be on BPC all the time, because it's going to protect. You know, where a lot of people get injuries is in the strain of the ligament and tendon. That's what BPC is protective of.
Can you combine? Can someone be on ipamorelin and BPC?
Yeah, so that's how we approach it, is because we've been doing this a while. Just like people stack supplements, we stack peptides. And we put, you know, again, from my observations of what works. And so we use 3, 4, 7, 9 peptides at a time, because that's where you really see some magic happen. Now, what we do is differently. We pre-fill syringes. We came up with a way to pre-fill syringes, and that's how we present them to our clients.
Yeah, that's what you're saying to me. That's what I was surprised about. Most people don't do that.
No, they don't do it because they don't really understand peptides. They don't have enough experience. And so they start, oh, use this one or use this two. Well, the trouble is if you're using 3, 5, 7 peptides a day, you're going to get very tired of drawing out 3, 5, 7 and then giving yourself that many shots.
Well, it's going back to the whole functional medicine supplement situation or pill thing, taking too much of it. Now you're just kind of taking a bazillion needles instead of a bazillion, oral pills or whatever.
Yeah. So but there's a blossoming number of peptides. So there's one for inflammation, great ones for the immune system, for the nervous system, cognitively, for you name it, there's going to be peptides.
And you're saying, though, it really it will work if you think it works, the placebo effect.
I mean, you're going to get things to work even if you don't think it'll work, right? But it's going to work better if you're mentally on board to making the choice for something to work for you.
So then why, if there's no side effects at all?
Very, very little. Some of the growth hormone releasing peptides, people get a little tingly and they'll get flushed about 5 minutes after the injection, 5 to 10 minutes. Transient goes away. Testosterone can cause a little bit of a welt under the skin. There seems to be a little local irritation, goes away. Other than that, no. I mean, literally
because,
no.
I mean, I know that I've heard people get bloated on it. People get, they feel like they're retaining a lot of water. For women.
Yeah, and there's some that will do that. And if you're, especially with the growth hormone releasing peptides, for example, GHRP6, which is the strongest, that can cause some bloating and fluid retention, fluid shifts. It's almost like growth hormone. So
then what happens? Does it go away?
It usually goes away as you use it. Yeah, you get that transition for sure that people can hang in there.
So then when does someone start going with the so this doesn't disrupt the hormones then, or
this should not disrupt hormones?
So because I was going to say, when does somebody go on a hormone like a testosterone or go on a peptide?
That's a good question. The way I approach that depends on what the patient wants to do, right? Like, so we'll have patients who will do lab work and we'll say, we check all your hormones, here's where you are, here's where you could be, here's how you get there. And sometimes we'll use peptides and say, particularly the best example is men, because they're way more straightforward. For them, a lot of times it's just testosterone replacement. And then helping with the fitness and the recovery, you can add that peptide for the growth hormone stuff. And they're like parallel treatments, right? So they don't really cross over and they're not going to affect each other, but they synergistically work together.
So it's interesting because there's so many subscription models are popping up, I feel now, right? For low testosterone, right? There's a lot of them. So I feel like that's become like a very big thing, but that doesn't necessarily help women per se, but I think
women need testosterone.
I was going to say there's a misconception, right?
Yeah.
So how do you know as a woman versus a male if it's a testosterone thing? I mean, you take a test. Is that now like can you explain this? Because there's progesterone, there's testosterone,
there's a lot of hormones.
There's a lot of hormones, and it's very scary to even start down that road, right? Because
I don't know if it's scary. It's just people are.
To me, it would be scary.
It's just there's a lack of understanding.
A lack of education and understanding.
And so a lot of doctors don't truly get it, even who operate in this space. And they kind of do this recipe book type of medicine where like, okay, these are low, we want you here, so here's how much. The trouble is everyone's a little bit different sensitivity-wise to testosterone, to all these hormones. For example, a man, again, we do a lot of testing, but it's not just about the number.
What number should you be at?
I don't think of a number.
Okay.
So there's a range. For example, for men, it's if we say 300 to 1200, it's a generalized range. By the way, let me point out for men, low testosterone is the number one risk factor for heart disease, stroke, depression, and dementia. So it's a big deal.
It's a big deal for men.
Big deal. But also men who have healthy testosterone levels have a higher quality of life too.
I would imagine, right?
So there's a sweet spot though. Every man's a little bit different to where they feel their best. And that's where the art of medicine comes in, kind of understanding the patient, getting to know the patient, following up with the patient, like here's what we want you to feel, here's what we're expecting. Oh, you're not. For example, I had a patient, this was several years ago, 38-year-old guy, low testosterone, gave him 1 shot of testosterone. In 3 days, he gained 9 pounds. That's because he was a fast converter to estrogen. Well, I couldn't have known that.
Wow.
You can't really know that. And so we had to put him on an estrogen blocker, and 3 days later, his weight had come off.
Oh, my gosh.
So there's a lot of different levers we have to turn, move. And the way I think about hormones, which is different, is like kids on a playground. They have different personalities.
Right.
There's some bullies, like cortisol, insulin, estrogen. Testosterone is like the happy, social, fun kid. Everyone wants a little bit of testosterone.
Right.
There's thyroid, there's growth hormone, and the interaction of all those hormones, setting up that playground is way more important than the individual one.
So the peptide, though, is a hormone. If you are screwing with the growth hormone
it's not technically a hormone. It's a peptide that's going to help you put out more growth hormone.
Right.
But it's safe. And then some of the misconception, people who are familiar with this, we measure growth hormone levels with this marker called insulin-like growth factor 1. When we use peptides, we don't really see the change in that number, but we know that the peptide is making that molecule more efficient inside the cells.
But then once you start, do you have to be on this all the time?
Well, what happens is most people like it, right?
Right.
Like people like how they feel. There's an uptick in their energy, their sleep, their mood, physical fitness, recovery. So they like that. The way I look at it is aim for about 3 months, and then we reevaluate. And the way we set up peptide schedules is take them Monday through Friday, take the weekends off. So we're putting a break within the cycle. So we don't oversaturate the receptors. We can let things come off and then bring them back.
Do you notice it's becoming more popular, or you still think there's people who...
I don't even think we've scratched the surface.
Right. Oh, yeah, exactly. Like,
it's
well, I guess
getting started.
No one really seems to understand. And so here, a lot of times, people aren't even getting access because of the FDA non-approval thing. Some people can't even get access to them. Why is that?
Well, there's peptide selling websites where people can order themselves.
But that's kind of... Aren't those like market, gray market? Or
no, not necessarily. It just... I think it's given a bad name because there's other peptide pharmacies who say, you shouldn't do that. It has to be an individualized prescription. There's some politics there, like anything.
Like anything, yeah.
But if you get down to it, peptides are super, super, super safe. So if someone's looking to optimize their health performance in a variety of arenas, peptides are an amazing choice.
Are you on a peptide?
I'm on a couple peptides. I had this health issue where this bracelet, I'm on a blood thinner because I developed these blood clots to my liver veins a couple months ago, fluky thing. Crazy stories in the hospital a couple times. But I'm on a couple different peptides, 3 of them, to help my blood be thin, help my blood vessels, things like that. I've tried all the peptides, but now I have to be more selective because the blood thinning medicine I'm on is
really? Did you try this? Were you on the epimorelin?
For sure. Yeah.
When did you see a difference in yourself?
I liked it. Yeah, I felt good. I had more energy. I thought it was good. The GHRP6, I didn't like that. I felt bloated on that. That's the one that causes severe hunger. So you do an injection within 10 minutes.
Wants? I don't need that. That's for sure.
Yeah.
Who needs to be hungrier? I'm starving. I would like to have like a suppressant. Do you have a peptide for suppressing the appetite and getting lean at the same time?
I don't know if there's a peptide that makes you have a suppressed appetite.
Well, I mean, then I don't. I mean, do they usually make you hungrier?
No, it's just this one.
That particular.
And that's a good one if you're looking to bulk up, get strong. Like, so we have people who are looking to put on muscle mass. It's an amazing one because then you're eating protein and you'll get big and strong quickly.
Which one's your friend on? The one over there.
He's on everything.
What are you on? He came with a really healthy looking friend who looks super
probably
fit.
on. Yeah, he's
what
probably
are you
on.
I'm on everything.
On everything? What peptide are you on?
Right now I'm taking a recovery. I had a shoulder injury.
BPC? What?
So it's BPC 157, TB 500, and GHKC copper.
Oh my gosh. Okay.
Yeah, there's cosmetic peptides. You mentioned the GHK copper.
Yeah, what's that?
So that grew up in the wound healing world, we use it when we use doing aesthetic procedures. So lasers, even Botox fillers, you can add GHK copper. If you use PRP in the scalp, you add GHK copper systemically, you're going to get a better result.
What is it called?
GHK-Cu.
And what does that do?
It has to do with copper exchange. It has to do with copper exchange, which has to do with wound healing. So it accelerates wound healing.
Oh,
so on the skin, and then on the cells, same thing. Like you're getting a more efficient recovery process of the damage or the injury.
Oh wow.
Yeah.
Okay.
That's a really good one.
That's a good one.
Mm-hmm. That's a longevity one as well.
It's very confusing. I
know.
It's like, how do people? I mean,
it's like
that's
alphabet soup.
It is.
Yeah.
That's why I think it's super important to have someone who's knowledgeable because it's very confusing.
It is confusing.
And then that's why these things are. When it's too confusing, I get overwhelmed.
For sure.
I like it simple.
Well, that's how we do it. We just break it down by lifestyle. So if people want a fat loss, we use a fat loss peptide. Right. If you're looking to sleep, we work with a lot of special forces guys and vets who need help, kind of repairing their brain, professional athletes. We have one for that. We have one for longevity, one for skin.
Yeah.
Yeah. That's how we break it down.
That's why a lot of people, I feel, break it down that way. And it's still confusing. If you ask questions, because you go down a rabbit hole and
You can. On our website, we do a pretty good job of explaining each peptide kind of how they're used, historically how they're used, how best to use it.
What you were saying earlier about how people are getting put on antidepressants and stuff like that, and most people, 50% of the people shouldn't even be on an antidepressant for lots of different reasons. Are there peptides that could help with anxiety, antidepressant, like cognitive things?
Two of them we use a lot. One is called CMAX. These two were developed in Russia. CMAX, S-E-M-A-X, was developed in Russia. They give it to people after having a stroke or a traumatic brain injury. What that does is it increases what's called the BDNF levels in the brain, which is like the juice that the neurons live in. So it's a very powerful one to help people after an injury, or if they're feeling depressed or can't focus, or we want to use a substitute for things like Adderall. It's a great one. Then we combine that with Selank, its chemical cousin, S-E-L-A-N-K, which taps into the GABA system in our nervous system, which is the inhibitory neurotransmitter, the calming one, and that helps people relax, helps with anxiety, things like that.
Well, I think that's what I think you put my friend on one of those. The cog for the brain. So then let's just, we're talking about the brain, and I know you're huge into NAD.
Yes.
And you say you've been doing NAD way before it was even popular.
Sure. Yes.
Let's tell people, because I talk about NAD sometimes, but if they ever listen, but can you tell us what NAD is, why it's important, and why you're a big believer in it?
Yeah. So NAD is a B3 vitamin derivative. So chemical cousin of niacin, was studied all the way back in like the 1930s, found to be helpful for two big things at the time. One was schizophrenia, the other was addiction.
Right.
Largely ignored by conventional medicine, resurfaced in the 90s, where people traveled to Mexico for intravenous NAD for addiction. In 2005, a gentleman from the States had a pain medicine addiction, traveled to Mexico, got the therapy, changed his life. At the time, there was only one injectable NAD in the world, made by a South African company. So he purchased the distribution rights, which he still owns, and set up a clinic in Atlanta called ExecuCare, where all they did was addiction. I got to know him, and then, I don't remember the timing, but we're talking probably 6 to 7 years ago. He got in touch with me and said, hey, I need some help, because he's not a doctor. I was big in the IV world, and he needs some help kind of getting information, questions answered for people, because people were starting to do more NAD. A lot of people still use it for addiction. We use it a little bit for addiction, but we kind of reshaped those first original protocols, which were very rigorous, and most people are familiar with. They read online about NAD causing, extreme stomach cramping, taking 6 to 8 hours. We re-engineered those protocols so most people can get through it in 1.5 to 2 hours at most.
So if you're not an addict, what else are the benefits of NAD, and doesn't your body produce it naturally? So
we get NAD from 2 dietary sources, tryptophan and niacin, and then we do a lot of recycling of NAD. And so NAD is used by our mitochondria, the kind of the battery of each cell. Yeah. And so one misconception is that we have one mitochondria per cell. We have thousands upon thousands per every cell. And so it's a lot of mitochondria. And so we need a lot of NAD. And so we need NAD to make ATP energy. It's the rate limiting substrate. So you want to do anything in your life, think a thought, move a finger, whatever, you need energy. And we know that as we get older, we're much less efficient at recycling NAD, so we make less energy. So then we age, get cancer, have diabetes, neurodegenerative disease. All these things are linked back to the mitochondria. The mitochondria are kind of the hotbed of research in terms of cancer prevention, prevention of aging, prevention of diabetes, treating all of these conditions go back to the mitochondria. So NAD is literally the foundation. You could make the bold claim the foundation of life goes back to NAD. It's that important, that foundational.
And when does it actually start to decrease in your own body?
So everyone's different, and we're actually about to start doing testing. It's not commercially available yet, but we're actually going to start that hopefully soon to figure some of that out, because that's an important missing piece, is what our NAD levels are. We don't know, right?
Right.
And so we don't have that information, objective information to say, okay, here's where you are, here's where we know you should be. So what I tell people, really, anyone who's interested in optimizing their health and performance should be involved with NAD. It's that powerful. And I can say that because we've overseen more intravenous NAD treatments probably anywhere else in the world. I mean, it's transformational.
Is it though? I mean, I've done it a few times, only 3 times for IVs. I take True Niagen. I told you the supplement, but it's more NR. And there's a difference, you said, between NR
Yeah, so NR, important molecule, NMN, those are precursors that help you make more NAD inside that mitochondria.
Exactly.
And so making more NAD leads you to be more efficient to make energy, ATP energy. So while those work, those are great.
It's different than an IV.
IV is different, but then the IVs have to be used, in my opinion, a certain way too. We came up with a loading dose. We had to do 5 treatments in 10 days to get people started, to kick it off.
Oh, hold on, how many? 5
treatments in 10 days. And that's because, again, observationally, most people doesn't kick in, like go into the science, until about the 4th or 5th treatment.
So, okay, so then when I did it, I think I did it like 4 or 5 times altogether. Yeah, I did one, and then I did one maybe again in like 2 or 3 weeks, or maybe a month, or maybe a month.
So you didn't do the proper loading dose.
Right, and then I did it again, and like maybe 2 months later. Like it was random.
Sure.
So
no, we don't do anything random.
So that doesn't help? Your body doesn't...
I'm sure it helps.
Take it? Okay.
So part of the issue is, and everyone's different, right? Different genetics, different stress, different upbringing, different development, different thought process. Everything's different. But what we observed is what we need to do that loading dose, because when we give people NAD, we increase the NAD to NADH ratio in the cell. And
the what? The NAD?
To NADH.
Oh, okay.
So NAD is actually, the molecule is NAD+.
Okay, right.
Right. And so we increase that ratio, which stimulates something called mitochondrial fission. Fission is splitting or removal of the defective mitochondria. This is where the quality control is brought back. This is how you prevent cancer, prevent aging, prevent diabetes. It's really a magical molecule. That doesn't feel good. That's where people don't feel good. And it takes a good, again, observationally, about 4 or 5 treatments for them to stimulate something called mitochondrial fusion. That's when you're bringing the mitochondria back together to make them more efficient. And now you're making way more ATP. And that's when the light turns on for people. So uniformly, what we do is we'll do a loading dose. Again, most people, 5 treatments in 10 days. We see them back in a week, and there's some uniform responses. My brain is getting bigger. I'm more creative. I'm sleeping less, but I have more energy. My mood's better. Colors look brighter. I'm able to language more. I handle stress better. That's because you are filled up your tank. You have way more energy in your battery. And I think the analogy I use with people is, when we're young, right? When you're 6 years old, you could run around 24 hours. You get up next day, do it. You have so much energy.
Right.
Well, now when you're 46 and you try to do that, no way, right?
Right.
You just don't
have... Well, not always, but...
You just don't have the tools. Your battery takes a lot longer to recharge. NAD makes that battery way more efficient.
But then what happens, because IVs, NAD IVs are expensive. They're no joke. They're expensive. They're like $1,000 an IV.
Well, that's here. In our office, it's $450.
Oh, so LA is just like...
No, well, there's a lot of price gouging.
Yeah, I mean, that's still, let's just say this, for the average Joe who doesn't have access, right? Or not even average, I mean, anybody, I mean, that's an expensive, you have to be able to afford it. So what do people do?
Well, so it's a choice, right?
Right, you don't have to take, is there a way that someone can get this without getting those, because now there's all those like subcutaneous NAD
so we do
shots.
Subcutaneous NAD. So, but it's the loading dose is 5 treatments in NADs, and then after that a maintenance dose of 1 per month. So you're not talking about as big of an expense. Like where we do it, $450 per month, I think that's reasonable for most people. The high cost is the loading dose.
Okay, wait, so...
5 treatments in 10 days,
that
loading.
one.
And then on average, most people do once a month.
But what was the other thing that you mentioned that you can do, the subcutaneous?
You can do subcutaneous if you don't have access to IV. We think, again, going back to the bioavailability, IV is 100%. We think of subcutaneous about 80%. Way better than 20% of oral.
Right.
So then you're doing a subcutaneous shot of NAD, smaller dose on a regular basis to get those NAD levels back up. And that's a great option. Great option.
That's interesting. Okay. And what happens if you do your program or if you anything in life, you stop doing it, does your body just kind of deplete that amount?
So are you asking if you start NAD and then you stop, will you be worse?
Exactly.
I don't think so.
Not worse, but you kind of just go back, like you just deplete this. Like how long does it last? Is basically
we think one IV treatment lasts about 3 weeks to keep
so
NAD's levels where we want them to be.
So this is not like this is not something you do at one time, and that
it's not going to cure anything. Yeah. And I don't think there's a lot of cures out there. I think that's the wrong question. I think we want to maintain. Right? And so we do all these things to maintain our nutrition and our fitness. If you stop exercising, you don't feel good after some point, right?
No, I mean,
So you have to maintain.
Everything is about consistency, really.
Same thing with these injectable therapies. And I think people ask the wrong question, like, I only want to do a little bit. But why aren't you asking, why can't I be my best as much as possible? People don't come at it that way. They think I'm going to get away with the shortcut because it costs money. Well, so does eating well and working out and doing all the things that, wearing the clothes you want to wear and looking the way, that costs money too.
Right. No,
but why don't you put the same question for how you want to feel and perform?
Yeah, no, I agree. And I know there's a lot of, people really swear by NAD. And that's why, like I said, I take True Niagen, I take this Pro version. And I know it's NR, right?
Yep.
And it's like, I think it's like a craze right now. Again, I forget where I am, but in the wellness space, I feel there's a lot of talk about NAD, confusion about NAD.
There is.
But there's like a lot of other benefits. So what are the overall, it does help you cognitively, you said focus.
So the way I think about it is it affects the nervous system first.
The nervous system, okay.
All right. So
and your immune system, does it overall help?
It can, yeah.
Okay.
But let's start with the nervous system. So it's going to help with your mood, help if you're anxious. We have a lot of, I could spend the rest of the day giving you case studies of how people it's benefited, their anxiety, their depression, their mood. It helps people from traumatic brain injuries. Again, we treated, I'll tell you a quick story. This just happened. We had a patient, he's in the Army, and then he got discharged from there, joined the police force. And he was in a bad helicopter accident and got paralyzed from the knees down. And he was referred to us by a former Navy SEAL, came to our office this week, and we do NAD, and we also combine it sometimes with ketamine.
That was my next question.
And so he did 2 treatments, and this guy has a ton of PTSD, major TBI, so much anxiety, depression, he needs a lot of help. But after 2 treatments, this was on Tuesday night after a second treatment, he called me and he said, I need some help. I can't be by myself. So we went and picked him up and spent the night with him.
You did? That was so nice of you.
Jeff and I, to talk through it.
Nice.
Yeah, to help him. And we spent, before he went to bed, several hours with him, just, helping him understand that, we're just getting started. This is going to be a new world for you. You're not going to be who you were before, but there's so much more for you to explore. And a lot of that comes from that NAD helping, kind of switch that nervous system around. And the ketamine helped open him up, surrender to being able to have those thoughts.
So talk about ketamine then. There's a lot of talk about that helping with anxiety and depression. And again, another one that...
Yeah, and so what we found is, again, because we've been doing this a while, combination of NAD, peptides, and ketamine for someone who wants to think their best and have the best outlook and to help their nervous system respond and operate in the highest level. That combination, that trifecta, there's nothing quite like it.
Really?
It's amazing. And so ketamine's an NMDA receptor antagonist. What that means is, to keep it simple, a lot of...
Too late.
So that controls the neurotransmitter glutamate in the nervous system.
Okay.
Glutamate is probably the most needed neurotransmitter for forming or consolidating memories. So most of our personality is formed before the age of 5, for sure. And most of us have some PTSD related to milestones not being met. It doesn't have to be major trauma, abuse, neglect, nothing. It can just be you just missed some milestones or things didn't work out. A lot of that happens through, again, sensory experience that you then process through your nervous system to form a memory. And so what ketamine does is, because it's an NMDA receptor antagonist, it slows down that glutamate across that neuron group of neurons. So then you are able to literally see things a little bit differently. And when you slow down your thinking, and you get a lot of insight and clarity, while at the same time you're helping your neurons make new connections to then consolidate new memories to have a new perceived reality in your world. And so that's why it's very powerful in the PTSD setting, because you literally help someone heal that trauma very quickly.
Wow.
Yeah. And then we combine it with NAD because NAD is kind of the fuel. And then you throw some peptides on board. Like I said, that one peptide Cmax to increase the BDNF. And now you've got this combination where you're set up this nervous system for success, in a very, very proactive way.
And so what happens if you solely take ketamine and not take the NAD or the peptides?
I mean, ketamine's going to have benefits on its own. So there's a lot of clinics now that are popping up, again, using intravenous ketamine, right? We don't use it intravenously. We use it intramuscularly.
Why?
Because we like to use intravenous NAD at the same time.
At that time. Okay. But if you weren't doing that, would you use it intramuscularly or no?
We don't really ever use ketamine by itself. Because
Okay.
because again, a lot of people are doing that. And again, there's a lot of people making a lot of money on that, which they don't need to be, because it's very, very inexpensive, by the way, ketamine.
Oh, it is?
Super inexpensive. But people are charging a ton of money for it, which is what it is. But what we do is we'll combine ketamine with NAD and see how people do. And then we created a nasal spray, which has ketamine and oxytocin in it, that people can do at home. Oxytocin's the social bonding love hormone. It kind of provides a safe landing.
nasal spray with ketamine?
Yes.
And oxytocin?
Yes. And
do you have any here? Can I try it?
we can figure that out. But it's been life-changing for so many. I mean, I talk to people every week who said this has been life-changing. Again, going back to this premise of like, I don't want to just put Band-Aids on things for people. I don't want people just to, you take this medicine and we make a little progress. Like, we want to transform people's lives. Ketamine's one of those tools.
Wow. So what would it do for again, when I don't mean the word average like that, I just mean someone who doesn't have maybe post-traumatic disorder or have like or they haven't had a major trauma that they're aware of. Okay?
Sure. So
what can it do for somebody who just wants to be, like optimal at their best or healthy? Can it help you?
For sure. Well, I think a lot of us, besides the physical optimization, the cognitive.
That's what I'm talking about. I'm not even talking physical. I'm talking just
clarity of mind, thinking clear thoughts, and then being able to make neuronal connections, understanding the bigger picture in life, finding meaning in all of these things.
Through a nasal spray?
Yes.
How is that possible?
Yeah, but it's because it's the ketamine.
It sounds like a snake oil.
It does, and there's a lot of people who would say it's such. But we've been doing this for years. And again, I get to talk to people all the time about this, certainly every week, who are telling me it's been transformed their life.
How much is this nasal spray?
It just depends. So, I mean, probably anywhere from about $150 a month.
And what is it? So you just spray it in your nose?
Yeah, and there's different ways to use it.
Is it instantaneous?
No, it also helps people, obviously, are into doing meditation, right? And that's become very popular. Like,
yes.
I'm not a good human unless I meditate, right? Like,
right.
Well, ketamine will enhance the meditation experience because, again,
I'm not a meditator. My running is my meditation.
Yeah, it's movement meditation. Yeah. So, but it'll enhance that meditation experience because, again, it slows down the higher processing centers of your brain.
Is it like weed?
Different.
What happens if I smoke weed and then take that spray?
You probably have a really good time.
Wow. Is it kind of similar?
No, they have different flavors. What's nice about, both, right? So obviously,
you don't have any on you. Why didn't you come bearing gifts?
So,
gosh.
Obviously,
to your wife later, but,
that's right.
Training you better.
That's right.
Yeah.
Marijuana obviously is becoming legalized now,
yeah.
and we recognize all of the health benefits. Right, certainly safer than alcohol.
Yeah.
A lot of good to come from the healing properties. Ketamine is piggybacking on that. So it's, again, different molecules doing different things, but at the same time, we're helping people to modulate stress in their world in a more, healthy manner than just drinking all day.
So wait, but if you're taking the ketamine, that nasal spray, the ketamine with the oxytocin, that combo, what is that combo? Like, you must be happy all day.
Well, you're not going to. No, the experience only lasts about an hour. It's very calming.
Can you get addicted to it?
I'm sure you could. Yeah,
if it's a great feeling. The oxytocin is, I would imagine, it's not great for drug addicts to be taking this thing.
Well, it could be actually because
instead of taking that, you can take that.
Well, we're helping to repair a brain that's not working well, right? So if we look at what happens with addiction, not to go too far down this rabbit hole, but in many ways, addiction is, the way I look at it is, I think we get it wrong in this country because we treat addiction. We say the opposite of addiction is sobriety.
Yeah.
Right? And if you refocus that and say the opposite of addiction is actually connection. For most addicts, they become addicted to heroin or cocaine or whatever because that became the first hug in their life, right? And if you all of a sudden take that away and don't replace that with some other purposeful, meaningful thing, why would they ever stop, right?
Yeah.
They wouldn't. So where ketamine, where NAD comes in, is NAD is the most powerful thing we've ever found to turn off cravings. It only takes about 2 or 3 treatments, and they don't have craving for tobacco, anything. Gotten people off of OxyContin, alcohol, you name it. We get them off that stuff. And then you can potentially use ketamine, on the back end to help provide some purpose and clarity to their thinking. So then you give them the bigger picture of, okay, I don't want to continue just taking a substance to feel better. I need to find a different purpose in my life.
Okay, and so if you're just someone like who just wants to be a high performer, you can take it to be more focused, more alert, more creative.
Yeah, slow down your thinking, understand what's happening. If you're problem solving, wonderful for problem solving.
You mean other things it's good for, other benefits? Not like that's not enough, but
I mean,
can you work out on it?
It's very calming. It's you.
Can you do yoga on it?
Yeah, you could definitely.
Or can you watch a movie and like?
Well, if you watch a movie or you watch TV on it, it gets a little weird because you start understanding the intentions of the people and the people. No joke, like you see, like I understand now what the director was trying to do in this scene.
It's like weed. I'm telling you, it's like basically smoking weed, basically.
It's a different feeling, different experience.
And do you take this all the time?
Not all the time.
But you do take it sometimes.
For sure.
Wow, this is like interesting. Okay, so I feel like, okay, and so I asked you about the fast vitamin, NAD, talked about, hormones, peptides. What else can I ask you? Is there anything else that you're doing over there in South Carolina that I should be familiar with?
We do a lot of NAD treatments. We do a lot of IVs. We have actually you talked about red light therapy. We actually have an intravenous laser we use on people where we shine the light inside their vein.
Now that's interesting. So
Yeah.
I've been doing this red light I had a bad knee, so I was doing that for the inflammation. Now I'm doing it for, my face. They say it's great for like fine lines.
Yeah.
It's great. What else is it? How do you use an IV?
So we use a fiber optic
for a red light?
Well, we have a couple colors of light. So we put in a fiber optic kind of thread into the IV catheter, and then you hook up a laser diode. So we'll shine red, blue, green, yellow.
I've
light.
never seen that. Are people doing that here?
I have no idea.
And what is it?
We'll
what's
start
the
it when
purpose of that?
if we get this practice opened here, we'll definitely do it here. Yeah. What is it? Well, just like you're using,
but just more.
You're using red light
Wow.
because you're using it as an anti-inflammatory tool to shine on a specific region of your body. When you shine it intravenously, you're getting it everywhere.
Everywhere.
Yeah. So it's just a different approach.
Who thought of that?
I certainly didn't, but it's this laser from Germany that we bought.
Are people actually using it?
We use it. We use it a lot. So we use, we do a lot of exosomes.
That's what I have here
Yeah.
that I didn't ask you
Yeah.
yet. It's right over here.
Yeah.
What is that?
Exosomes are acellular, so they're not live cells. We think of them like the envelope that carries a message. Like stem cells, they're basically signaling molecules. So when you take exosomes like stem cells, you're going to signal for an anti-inflammatory cascade to go wherever you put it. So we do it intravenously because then we can hit the whole body. But say you knee injury, we'll do a lot of this local injection where we'll take exosomes, we'll mix it with a peptide like BPC and some other things.
Is it like stem cells?
It's like stem cells.
Okay.
And then we'll inject that into your knee, and then we'll give you IV stem cells and then shine the light on you. And we have great success with that for local injuries.
So how is exosome different than a stem cell?
So a stem cell's a live cell, right? A lot of them come from publicly donated umbilical cords, mostly from cesarean section, tested, filtered, make sure. But the difference is exosomes are acellular; they're not live cells, whereas stem cells are live cells.
Right.
I think exosomes are going to survive longer than stem cells.
You do?
Yeah, there's going to be a lot more scrutiny about stem cells. This is because the FDA, because they're live cells, and how you manipulate or use those cells is coming into question. Whereas exosomes, they're not live cells, but they're still signaling molecules. Exosomes will likely replace PRP, if you're familiar with PRP, platelet-rich plasma, because they're so much stronger on the regenerative side.
Because people use that PRP when you get microneedling, beauty things like that.
We do that with exosomes.
You use instead of PRP?
Yeah.
And what happens?
So what we'll do is, microneedling, or we'll do different laser treatments, open up the, pores, and then topically you can rub on exosomes, and we send people home with the exosomes to do it later in the day or that evening to then get a more regenerative effect.
This is amazing.
Yeah.
I wish I lived in South Carolina just for like a couple months to get all these things.
Well, we do. We have people, every week people come to our office, and my wife runs the aesthetic side. And so we'll do we do all the regenerative side, and then people will come for NAD or exosome ketamine. And then while they're there, they're going to get, cool peel, Fraxel, all that, because they can do it all in the same place. And so it's that premise of when people look good, they want to feel good, and same reverse true when they look good, they want to feel good.
Yeah.
We can do it all and combine. And really the magic and the cool part going into the future is combining all these therapies in safe ways that really accelerate how quickly we can make up ground.
Wow, this is amazing. I've learned something. I feel like I've learned something. I hope people feel that they've also learned something. I'm more confused, but yet at the same on some things, but I'm not confused. Sometimes a lot of times you have too much information at once. It can get a little bit confusing.
Sure.
But you do a lot of cool
We do.
stuff.
We're very privileged.
Yeah.
We're very privileged, and we're big fans of, people trial and error. That's the way people learn. Right?
Yeah.
Like you can read about it all day long and talk about it, but until you try injecting a peptide into you, how do you know?
You don't.
And I want people to have all the options. I don't want it to be like, oh, you can't use a peptide or you can't use a hormone. Or don't do that. Why not? That's the only way you're going to know.
It's true. It's trial and error.
Yep.
So how do people find you, know about, how do they get more information if they're curious?
Probably two main sources. One is our website, which is koniverwellness.com. And then on Instagram, that's really the only social media we do is at Koniver Wellness. And we enjoy talking about this. We have a whole video series we did for COVID about immune system optimization where we cover all these topics. I think we have 12 or 13 different videos that people can watch just to learn.
Yeah.
Because the more educated people are, and for better or for worse, there's a lot of people, doctors and practices jumping into this space because they say, oh, this is the next thing.
Mm-hmm.
And there's not a lot of knowledge that comes from that. And so that's why we do training. We have people, literally physicians, come to Charleston every single week and spend a day with us where we are an open playbook and we want to collaborate with them to help their patients. Because that's
incredible.
Yeah, the more people are doing this stuff, the better for all of us.
Wow. Well, thank you so much for being on the podcast.
Well, thank you for having me.
I really
this is
appreciate
great.
it.
I love talking about this stuff, so thank you.
Good. You can come back again.
No,
and I'm going to try some of these things, and then we'll do like a recap together.
Okay.
And I'll say, this is good. I hate that.
Yeah.
That type of I wouldn't say, well, I would actually.
If you hate it, you hate it. So
I don't think I would, but I really appreciate you being here.
Oh, well, thank you. I appreciate you having me.
Thank
you very much.
All right, guys. We're out. Bye.
Habits and hustle, time to get it rolling. Stay up on the grind, don't stop, keep it going. Habits and hustle, from nothing into something. All out, hosted by Jennifer Cohen. Visionaries, tune in, you can get to know them. Be inspired, this is your moment. Excuses, we ain't having that. The Habits and Hustle podcast, powered by Habit Nest.